Hello, doTERRA friends. Just wanted to take a quick moment to address you with all the chaos that's going on in the world right now and the craziness, just to kind of help you understand what's going on in the world. Particularly right now, as I've spoken with several friends that work in emergency rooms, they're getting overrun with people that are curious whether or not they have a viral infection, as opposed to needing medical care. And when we do that, we overrun our medical system and we don't leave resources for those that really need to be seen there. So I want to address that. Also, maybe signs and symptoms to look for with COVID-19. I know Dr. Osguthorpe has been addressing these. And then also maybe some ideas behind why we're quarantining and why it's important for us to self-quarantine. Let's start with that one for a minute. Let me just give you some statistics. And some of these have to do with the world stage, and then others of it have to do with just us here in the U.S. So to give you an example, Italy on 3/7, so March 7th of this year, had 7,400 cases or so of COVID-19. As of today, they're at about 35,353 cases, and that includes 2,978 deaths. And of course, we have great concern, and we're praying for those people there. In the U.S., as of today, we have 7,038 cases and 97 deaths. So we're lagging about 12 days behind where Italy was. And so, as you can see from just hearing those statistics, we're putting some things in place now that the Italian government, I think, didn't know to put in place when they were at 7,000 cases. And so we're being able to do that now to prevent us from getting to where they are. Keep in mind that Italy has a population of 50 to 70 million patients or people, and in the U.S. we're at about 350 million people. Some very good epidemiologists and infectious disease doctors have indicated that it's likely within the next 12 to 18 months, we'll have 40 to 70% of the U.S. population infected with COVID-19, and that we'll likely have around 1.6 million deaths from this. To give you some perspective on that, last year for all types of cancer, we had 600,000 deaths in the United States. So this is a significant thing. And so we're self-quarantining to help cause the rise of the disease to not be so significant amongst our population. We're hearing some very sad stories out of Europe where physicians are having to determine who gets treated with a ventilator and an ICU bed and who does not, which means they're making life and death decisions just based upon availability. And so here in the U.S., we're really trying to keep, rather than a steep rise of people infected with this disease, we're really trying to keep it to where we can have this disease go through the community at a slower pace so that we have resources available for everyone that does get sick. And so please, as we recommend self-quarantining, as we recommend just being with your families and working from home, that you don't take this opportunity to have play dates with friends and other family members and have group gatherings in your home. This is really a time to be conscientious of what we're doing for the community as a whole, and that we as individuals need to take responsibility for what we're for our community as a whole, and make sure that we're not being vectors for this disease. So some symptoms of COVID-19, the three that we are commonly seeing right now is fevers, and that means a temperature greater than 100.4. So a lot of people will come in and say they have a fever and it's 99 degrees. That is not by medical definition of fever. So 100.4 or higher, and we're seeing typically high temperatures with this, 102, 103, 104 degrees. Also, cough is a common symptom of this, as well as shortness of breath. The problem is that you can be shedding this virus for 2 to 10 days, even before you come down with the illness. So again, we're asking you to stay in your home so that if you happen to be infected with the virus, but not yet symptomatic, that you're not sharing it with a number of other people before you come down ill. So that being said, let me talk to you about reasons to call 911, reasons to go to an emergency room, and reasons to be going to an urgent care or calling your physician's office. So let's go with the most serious ones first. Reasons to call 911. If someone has stopped breathing or is choking and you're needing to administer CPR or the Heimlich maneuver, you need to be calling 911. Emergency medicine, emergency vehicles can get to you faster than you can get that person to an emergency room. So you call 911 in those moments. A head injury that's caused a loss of consciousness or significant confusion is also a reason to call 911. Severe chest pain and pressure, as well as a seizure lasting longer than 3 to 5 minutes. All of those reasons, and there are more, but all of those reasons are the main reasons that you would want to call 911 as opposed to loading someone up and trying to get them to an emergency department. So why should you access the emergency department? Why should you be going in and seeing an emergency department? If you have significant difficulty breathing, is a good reason. Chest pain or significant jaw pain or arm pain, all of those can be symptoms of cardiac problems, and women and men present a little differently. We tend to think of chest pain for heart attack, and that is a typical presentation for a man. But women can have a heart attack and not presenting with any chest pain and only have jaw pain or left arm pain. So you want to pay attention to significant pain there and go to an emergency room. A displaced fracture or open fracture. So if you've broken a bone and it's hanging out of the skin, you need to go to an emergency room. If you've broken a bone and it's significantly displaced, meaning the arm doesn't look normal at all, then or leg, then you need to go see an emergency department. Sudden numbness or weakness or being unable to speak, see, walk, or move are symptoms of a stroke. When it comes to stroke and heart attack, seconds count. There are certain interventions that we can do if you arrive into an emergency department within a certain amount of time. If you go outside of that window of time, let's just see if the symptoms resolve, let's see if my chest pain goes away, then there are interventions when you do show up that we cannot administer to you. So when it comes to stroke-like symptoms and heart attack symptoms, you want to access the emergency department very, very quickly. Bleeding that can't be stopped, obviously abdominal pain that's intense and particularly localized abdominal pain, you want to access the emergency room. Fevers in anyone that's less than 3 months old is significant. Fevers with convulsions in any age group, you should seek emergency care. And then coughing or vomiting blood. Let me just stop for a minute and tell you, one of the challenges that we have if patients will come from an emergency room and come into our offices saying, well, Dr. Riggs, they didn't do anything for me. I still don't know what's going on with me. And what I tell them is the fact the emergency room is not meant to diagnose what's going on with you. An emergency room is to determine, are you going to live or die from what you have going on? As long as they can evaluate and rule out the things that you're going to die from, they'll send you back to your primary care office to be evaluated there to know if, to figure out what the diagnosis is. And so please understand the frustration that you have is that you don't come away with a diagnosis in which what you did pay them for is to determine, are you going to die from what you have going on today? Some reasons that you might want to seek care in an urgent care: cough and cold symptoms, sore throats, rashes, skin irritations, fever or flu-like symptoms. You can access an urgent care. And then mild injuries, so sprained ankles, those sorts of things. Urgent cares are fabulous for that. Primary care offices are fabulous for that. So I'll close by saying stay safe, stay home. Please make sure that you and your loved ones are safe. If you're having difficulty with staying home, I know that feels very isolated and the challenges that come with that. Please use Skype and Zoom and phone and just reach out to other people, grandparents, etc., and speak with them that way so that you have that social interaction while you're doing the self-isolation and can remain mentally healthy and help keep the community physically healthy. So appreciate you all, love you all, and best of luck in the coming weeks.